and advisories. I'm going to go through the next slide and tell you what we can follow through. So need to avoid being exposure to the virus. So virus is not seen, yeah. So we cannot see this virus with the naked eye. So how to avoid this? Somebody who's ill, somebody you think or the other person says that I am likely to be infected, or he feels sick, or you can see him that he's sick. You need to avoid that person. So avoid close contact to the people who are sick is definitely a mandatory thing, whosoever it is. So if you see someone who is visibly coughing, sneezing, or is sick, just maintain a good amount of a distance. A good distance is somewhere to half meter to 2 meters. 2 meters being a very safe one. I'll tell you the reason why I have chosen this 2 meter distance. Not me, but it's a fact that 2 meters is a safer distance as compared to the other ones. So definitely maintain this kind of a distance, and even avoid crowding, because some people may be mildly sick who may not be coughing persistently. With even a mild cough, nobody can judge out the who person is sick or not. Even those can transmit virus. So if you see a sick person, please avoid contact. Don't go in crowds. That could be harmful. And then in normal days, it says that even more than 300 times a person touches his face in 1 hour. So avoid touching your eyes, nose, mouth. Stay home when sick. Sick means you feel those symptoms, but do take a medical advice. Doesn't mean that you have to stay home and you're not supposed to go to the doctor or the hospital, or you're not supposed to take that advice. No, that doesn't mean so. Staying home means when you're sick, you're on treatment, please do not go outside. Do not get interact to any other people. Cover your cough or sneeze with a tissue. Yeah, avoid handkerchiefs, not regular handkerchiefs which we were using before. Just a normal paper tissues, and throw it into the dustbin. And the dustbin should be the closed one. It should be a lid dustbin, not an open dustbin. Clean your hands with soap, water, any soap you prefer, with alcohol-based sanitizers when the soap or water is available. So these are the things you should definitely regularly follow. Hello. Yeah. So why I was saying the 2 meter distance is important. When a person, please see on the screens, when a person who is not wearing a mask, he coughs or sneezes. So the particles usually travel. A lot of particles will be somewhere around the 0.5 meter distance. Then to the 1.5, most of them sheds down, being heavy particles, and they settle down. And till 2 meters, hardly any particles reach, except the sneezing. When a person sneezes, the velocity or the speed is so much of the particles that it may even reach up to 6 meters. And luckily, this patient is COVID or Corona. They do sneeze, but this is one of the rarest symptom. The cough is the most common one. So that is the reason 2 meter distance has been chosen rather than the 6 meters. So what next? Wearing a mask. Everyone must have seen that wearing a mask is something, is something happening the same way we used to wear helmets for our two-wheelers. Ki chalan nahi ho jaye ya koi rok nahi laye. Please don't do that, because wearing the properly mask is very much important. Just on your screens, the Malaika Arora is shown with the wrong versions where we have put the cross mark, and the right version with the green tick. How to wear a mask properly. So it has to be covering your nose and the mouth, both of them, not a single portion, and definitely not at your below the chin. That serves no purpose, not at all. Although she has been infected, probably the reason something else, maybe Arjun Kapoor, not the mask. So we definitely need to follow this precautionary wearing a proper mask in a proper manner. A few of the pictures, you can see a lot of people around wearing a mask, touching each other, will not serve the purpose at all. This is gonna be bad for everyone. The transmission of disease is gonna make a big chain out of it. So this kind of a crowding or public gathering, or whether it's whether you're traveling in any kind of a transport, it's not gonna solve the purpose. It's gonna create a lot of problems. So not to follow this, not to follow this. And then again, what about the cleaning part? Every day, everyone, a lot of our housewives clean and make sure their homes are clean. So it's going to be same, nothing much more special chemicals or acids to be added to the same. Just clean and disinfect, frequently touch objects, the door handles, the shelves, the computer tables, the study tables. and surfaces using a regular household clean spray or a Colin or whatever you are using in your homes or your offices. That has to be, a little more particular, maybe twice a day, so that it should be clean enough. Maybe more, depending upon the surfaces being touched by multiple people or a single person. Wash your hands thoroughly. So washing hands is very, very, very important. And there is a slight, maneuver how to wash those hands. I'm going to tell you. First thing is washing of hands, just putting under water tap is not going to serve the purpose again. You need to use soap and wash your hands at least for 20 seconds. So it should be below the nails, in between the fingers, till the wrists, and along with palms and the top of the hands. So every part of the hand should be cleaned, washed properly, at least for 20 seconds, not less than that. So as already spoken that avoid close contacts, do not spit in the public, no tobacco, no pan chewing, nothing should be done in the public places. Otherwise also it shouldn't be done. And if you have any fever, cough, difficulty in breathing, definitely go for a medical advice. It is a must. Because once the disease gets flared up, it's very, very difficult to control this one. So when do you want to wash your hands? Obviously after coughing or sneezing, when caring of a sick person, before having your meals, after using the toilet, after you're visiting some outside place. So these are the times you're going to definitely wash your hands. And whenever you feel your hands are dirty, you need to wash them. As we are following Namaste, yeah, that's a good thing. We have already spoken about that. Wearing a glove, a lot of questions comes that if we wear a glove, so wearing a glove is not going to, give you any kind of a coverage. Whatever is not touching your hands is going to touch your gloves, and if those gloves, you're going to touch your face or any other one's face, the infection is going to come, or the virus is going to get transmitted. So gloves is nothing; it's just a gear which, if you don't clean your hands, if you don't clean your gloves, it's going to give the same purpose what your hands are giving. So there is no extra benefit of wearing gloves. How can a grocery? Yeah, groceries are safe. Everyone needs to buy the grocery. It's a daily needs, daily soaps. So when you go to the shops, you have to follow a few precautions. When you go to the supermarkets, maintain an adequate distance, at least of 1 meter. You need to sanitize all those buckets you're carrying with you, all those trolleys. And at that time, possibly you can wear some, disposable gloves so that you're not touching anywhere else. And then you can remove those gloves and wash your hands. Avoid always touching your face, even with those gloves and all. Washing articles doesn't solve a purpose, because usually these kind of things doesn't carry viruses. It doesn't spread with coins and money, but definitely when you operate your ATMs, you need to wash your hands again. So the few terminologies which has been commonly used is the home quarantine. So home quarantine is, how do you define that? And what is the difference between the home quarantine and home isolation? I'm going to tell you a few of these things. So when it has been said that you have been quarantined, it says that you have been separated or restricted the movement of the people who are exposed to a contagious disease, and they may get possibly sick. So these people may have been exposed to the disease and they don't know, or they may have the disease but they don't show the symptoms. So when they are not confirmed, so they need to be quarantined, because maybe the family members, those who have been sick but they don't have any symptoms, so these people has to be quarantined. And what about the isolation? Isolation is something which separates the sick person who has been diseased with this, confirmed with this virus, with this disease, and people who are not sick. So this person has to be in a different place or a different room with those who are not showing any kind of symptoms. If two people are showing the symptoms, they can stay together. They won't be doing any kind of a cross disease or a cross spreading of the disease. So it's although the slide says advisory for elderly, definitely more for them, but to be followed for everyone. So I wouldn't say that it should be only for elderly. Staying home, whenever necessary, need to go home, go outside the home only for the work. I know work is very important. So, only essential things to be seen. Distance should be maintained. Hello. So not those old habits of having tea, coffee with your colleagues in the offices, having a lunch at the same time on a single table, sharing those foods. These kind of things we need to change these days. So this is exactly a new normal which we cannot follow these days. Washing your hands, sneezing and the cough etiquette has to follow. Nutrition is must. You should have a home cooked food. You should have an adequate nutrition so that you can have a good immunity. A lot of water should be taken because a good hydration will also give you a lot of benefit to fight with the disease. Exercise and meditation are another important parts to be followed. Those who are having any kind of disease, whether it's a diabetes or a hypertension or any other kind of a disease, they should take their medications regularly. And those who are elderly people who are staying somewhere away from you, please talk to them. If they cannot go out, make a video call out of it. And those who need to visit the hospitals, only visit for the emergency purposes. All those elective surgeries and all those things can be postponed. So monitor your health. Any kind of symptoms you feel any kind of those symptoms of fever, cough, and anything, you should definitely go to the hospital or visit your doctor, or even get a teleconsult done these days. Advisory for the children, definitely the schools are not working. That's good, and so they shouldn't be going out to the playgrounds. Don't mix up them, all the kind of people around. Yeah, they should play in their home premises. No mask to be worn for the children who are less than 2 ages because they don't know how to breathe. So it could be problematic for those children who are less than 2 years. So by showing a lot of things which were negative as well, and then telling those bad numbers, that doesn't mean we need to panic. We have a positivity in those slides as well, that we had a very good, a recovery rate. So there's nothing to panic about this. But yeah, we do need to take some home messages from these slides. Why not to panic is because 80% of the world, even more than 80%, I would say, has shown a good recovery. Death rate in India is around 2%. I'm not saying 2% means too less, because as we have already spoken that we are 1.3 billion people. So, but 2% means need to be cautious, but not to get panic or afraid. Most of the people who are infected have shown mild form of disease. That's again a good part. Just a khansi zukham and a mild fever, and they get settled down. In the past, we must have heard about infections like Ebola, SARS, MERS. Not as much talked about, because they were not so contagious as COVID-19 is, but they were very much lethal. So fingers crossed, and thank God that this disease is not that lethal, but definitely it is more contagious, very much more contagious, and forming a big change of the human. So prevention and precaution are the most important to follow. Yeah, definitely. So once being infected, the things get changed, and if you don't get, that's the best part. So do not treat yourself, please. Because being a doctor, I know the pharmacies out of azithromycin, starting with hydroxychloroquine and doxycycline, these drugs to be taken after the prescription, because a lot of these drugs have some side effects. So please do not treat yourself. And as it is not the end, how long it's going to stay, nobody knows. When we are going to get the vaccine, still big question marks. So by following these preventions and precautions, we can save ourselves, our friends and families, and we can help even us being doctors. The less the patient comes to us, the less worried we are, and easy for us to manage as well. So this was just a part of a few slides I could talk about. So I'll thank you all for listening patiently all those slides and my talk. So I would request any questions and queries, we can have a good interactive session, so that I can answer your queries. You must be having a lot of queries. So we can please proceed further. I'm done with my slides right now.
Thank you, Dr. Mohit.
Yes, sir.
Thank you, Dr. Mohit. We had a very interactive session and informative session from your side.
Thank you so much.
I request anyone who want to question anything and want to know anything, are requested to put their questions in chat box, so that your queries can be answered very easily. As if everybody get unmute and will answer, it will be difficult to Dr. Saab also for give answers. So it will be good ki whosoever has any query are requested to post the same in chat box, it will be easy for him to give the answers of your queries. And
Uh,
now chat box is open for everyone to send their queries.
Anshum ji, hello.
Hanji.
Uh,
Yes, sir.
do one thing. You can just read up, the questions one by one, and I can answer that.
Okay. Okay.